Ed Paget here from edpaget.com. Today I'm going to talk to you about a very important muscle in your back that can be the key to relieving back pain. It's called the QL, or quadratus lumborum. Look, it goes from this bone here, the 12th rib, and down to the iliac ridge, but it also connects to each one of these bony bits on the spine called the transverse processes. And when this muscle gets irritated or goes into spasm, it can cause that deep ache into your lower back, and that can even spread into the top part of your butt cheeks. So what do you do about it? Well, one way to fix this is to stretch it out, and that can help relieve the spasm. So if you look at this skeleton here, if I wanted to stretch this muscle that goes from here to here, I would lean to the right hand side to stretch my left one. Then I would rotate a little bit, and you can see how this takes the hip bone here further away from the rib. And then I would either flex forward or flex back into extension. So I'm going to show you how to do that on yourself. Okay, so what we're going to do is I'm going to stretch my left QL, it's this one here. So I'm going to plant my left foot back, drive my heel into the ground, and that stops my pelvis from moving. Then I'm going to take my hand up over my head and lean to the right. So what we've got here is this lateral flexion or side bending, and I'm opening up those ribs. Then I'm going to flex forward as I do this, and you can see that this really is opening up the left side of my body. Then I'm going to step back here. And that is a stretch, then a contraction. And the reason we want to do that is to get rid of these muscle spasms. The muscle has to be lengthened and then shortened. And it acts as a pump, and it pumps out the waste products. The waste products are the things that cause pain when a muscle is in spasm. But also, we want to imagine that we're playing baseball, and we're catching a ball with this hand here. And the ball is going to come in from over here at about a foot off the ground, or 30 centimeters. So I'm stepping forward, catching that ball, and then stepping back. Stepping forward, catching that ball, and stepping back. And now here's another tip. If you've got pain on one side, it's best to do this exercise on both sides, because these two muscles go here and here. These two muscles work in conjunction with each other. So if you can, it's not too painful, do this exercise about 5 to 10 times on both sides, and that will take care of the spasm in the QL muscle and get you out of pain. So go on, give that a go.